Today, we'll discuss instruments used in gynecological procedures.
In this video, we shall explore the essential tools used in operative gynecology and obstetrics. Each instrument here plays a critical role in diagnosis, management, and surgical procedures. Let's go through them one by one.
Uterine holding forceps.
This instrument is specially designed for holding the uterus firmly during surgical procedures. It provides a steady grip without causing trauma. It is particularly used during salpingectomy or other gynecological surgeries where uterine stabilization is required. Its long handles and curved jaws make it ideal for deep pelvic holding during operation.
Nelaton forceps.
The Nelaton forceps have round blades with central fenestration and transverse serrations on the inner surface for better hold. They are mainly used to grasp and hold ovarian cysts during operations, providing controlled traction without rupture. The design minimizes trauma injury to the tissues and ensures a firm grip on delicate cyst walls.
Willet Scalp traction forceps.
This is an important obstetric instrument used in conditions like placenta previa type 1 and type 2. Its small, rectangular, oblique serrated blades have two tiny teeth, one on one blade that fit into matching holes on the other, ensuring a very secure grip on the fetal scalp. It provides traction over the fetal skull, which helps compress the bleeding site and reduces maternal blood loss.
Simpson's uterine sound.
The Simpson uterine sound is a graduated metallic rod around 12 inches long with a blunt tip and a 60-degree distal curve. It helps determine the length, direction, and position of the uterine cavity before procedures such as cervical dilation or curettage. It can also act as an initial dilator before using mechanical dilators. Accurate sounding prevents uterine perforation and ensures safe instrumentation.
Ayre spatula.
This is a simple, disposable wooden instrument used for pap smear collection. It is used to scrape superficial epithelial cells from the cervix and vaginal walls for cytological screening for malignancy. The tip is inserted into the external orifice, rotated through 360 degrees, and the collected sample is spread on a glass slide. No lubricants or antiseptics should be used before taking the smear to avoid false results. For hormonal cytology, scraping is done from the lateral vaginal wall.
Gelpi's vulval retractor.
It is a self-retaining retractor used for exposing the vulva and vaginal walls during gynecological surgeries. After anesthesia, its sharp prongs are applied to the inner vulval edges and gently opened, providing a clear surgical field. It allows the surgeon to work hands-free with excellent visibility inside the vaginal canal.
Pinard Foetoscope.
It is a conical, hollow tube used for auscultating fetal heart sounds during pregnancy. The broad end is placed over the mother's abdomen while the examiner ear is applied to the narrow end. It's a simple yet essential instrument for monitoring fetal well-being, especially in low resources or clinical settings. Even today, it remains an essential tool in obstetric practice.
Pelvimeter.
Pelvimeter is used to measure external pelvic diameters to assess pelvic capacity. The most common measurement is intertrochanteric diameter, which is about 12.5 inches. These measurements help in evaluating whether vaginal delivery is possible or if cephalopelvic disproportion exists. It is a crucial obstetric assessment tool before and during labor.
Uterine biopsy curette.
The uterine biopsy curette is a slender, hollow instrument with a blunt tip and a slight angulation near its end for easy insertion. It is used to obtain endometrial tissue samples for diagnostic purposes such as detecting the endometrial carcinoma, tuberculosis, or to evaluate infertility and ovulatory function. The attached stylet helps remove the collected specimen. It is a key instrument in both diagnostic and therapeutic curettage. Each of these tools has its own clinical importance from diagnostic evaluation to complex obstetric management. If you have not watched the part 1 video yet, please make sure to check it in the Gynecological Instrument playlist on MedScope.
Stay tuned for our upcoming videos on procedure-based instrument sets and uplift demonstrations.